Hello, this is Kim McAllister, and we're going to talk today about credentialing, accreditation, and licensure. This is part of our Leadership and Management program here at Schreiner University. So let's talk about what credentialing is. Credentialing is a documentation that you can provide showing that you have specific qualifications. It can also indicate someone's performance level. It can be used to indicate academic achievement, and your nursing license itself is a legal credential. So now let's really get into the topic and look at the different parts of credentialing. So licensure protects the public by requiring that nurses demonstrate a minimum level of competency in order to grant rights to practice. Boards of nursing are required to oversee the process and maintain accountability for protecting the public. Nursing programs require board approval to allow graduates to take examinations for licensure. Nursing programs, in other words, have to have full board approval before their students, after graduation, can take the board exam. And they are the gatekeepers of the licensure process for both registered and vocational nurses. Each state defines the structure and scope of the Board of Nursing. Practice alters from state to state, so the nurse is required to be familiar with the Nurse Practice Act of whatever state they are practicing. So each state has joined the National Council of State Boards of Nursing. This formed in 1978 to provide a standard examination for registered nurses and vocational nurses, and to provide some continuity for nursing programs. We'll talk in a moment about accreditation, and there's several different accrediting bodies for nursing programs, but the National Council provides one set of standard outcomes that all nursing programs have to have. So you have to include their outcomes, and then you can add on if you wish to. Certification is voluntary, and it's awarded to individuals. Nurses complete the process by conforming to standards established by a profession for practice in a particular specialization. We're going to look at the ANA Nurse Credentialing Center. And the Nurse Credentialing Center provides the majority of our nursing specialization and certification information. And so they have a whole list of certifications, and you can go here to apply. And it's low. And so after you get your certification, then you have to maintain it. And in order to maintain it, you have to do certain things to renew it, including filling out information and paying, but you also have to have certain continuing education in order to keep that certification current. And here it shows different nurse practitioner certifications, different interprofessional certifications, specialties, and so on. And there's more than one page of those. And so nurses that want to become specialized in their area, they want to become certified in their area, can look at the different certifications and see what they need to do. And they generally require a certain amount of time practicing in the area and some education, and there's usually an exam that you take to prove that you have the information that you need. They also have, let's look at some other things. There's also retired recognition, so after you retire, you can continue to have the recognition of being certified. It's an inactive type certification. Also understand that when you're certified, you usually get an increase in pay, which is very nice. And so this has all the different policies and so forth and information. And I'll put this link on the module so that you can come back to it. So understand that credentialing is important. Certification is important, and it is very helpful if you not only want to raise a recognition in your area, but it also makes your employer look better and will help with things like magnet and other recognition. Getting a certification will also help you advance on your clinical ladder, which is very nice as well. So just to understand what you are when you graduate from a baccalaureate program, you're a nurse generalist. And this means you have a broad or general nursing information. And then whatever area you choose to practice in, you'll begin to have some special information on that area. But in order to be considered a specialist, a nurse specialist, you have to go and obtain an advanced degree. And then there are other degrees beyond that as well. Let's take a look at accreditation. Accreditation is voluntary, but it's often required in the case of regulations or requirements by entities. For instance, the Center for Medicare and Medicaid Services, called CMS, requires that hospitals be accredited by their regulating body in order to receive reimbursement from their patients. That's the same with home care agencies and other agencies as well. And the bulk of all patient care is with Medicaid and Medicare patients, so this is really important. Nursing programs likewise have options to be accredited. This differs from the requirement of your Board of Nursing approval. The accreditation programs include the Accreditation Commission for Education and Nursing, and they also hold the Commission of Collegiate Nursing Education, CCNE, which is our certification, and accreditation. And you may recall their visit last February. We all certainly do. In addition, there's a newer agency by the NLN, the National League for Nursing Commission for Nursing Education, called CNEA, and this began in 2016 and also provides accreditation. Accreditation is important for graduates who wish to pursue graduate degrees, so many places require that all applicants come from an accredited baccalaureate program. Understand that there is a shortage of nurses. I imagine that's not a surprise. And so we need almost 500,000 replacements. And so that means there's going to be lots of job openings. But we also have a shortage of faculty. And the reason that applies to the shortage of nurses is there are tens of thousands of students who apply to nursing programs who are turned away because we don't have enough faculty to teach everybody. And so we need you to consider becoming instructors, and you need to go on and get a graduate degree in order to do that. So get your degree, come back and work with us. That would be cool. The reason is that most nurses can earn a lot more out in the private sector and clinical areas than they do in teaching. So come work with us and join us and help us promote nursing.